Osteoporosis is one of those silent, sneaky diseases. You might not even know you have it until the unthinkable happens: a fall, a broken bone, and suddenly, you're faced with a condition that weakens your bones and puts your quality of life at risk. But here's the thing: you can't just ignore it. As we age, we naturally lose bone density. That's the reality. The question is, how much is too much? Let's break it down. Age is a primary risk factor for osteoporosis. And it's something no one can escape. We all start losing bone mass once we hit 30. And this process accelerates once we reach the age of 50. But what really sets the stage for osteoporosis in older adults is the decrease in estrogen and testosterone levels. After menopause, women experience a sharp drop in estrogen. And as men age, their testosterone levels naturally decline too. It's like watching a slow-motion car crash. You can see the changes happening. But it's almost too late to stop the damage once it's started. You might be thinking, I'm fine, I feel okay. But osteoporosis is a sneaky disease. Hiding in plain sight, you don't feel the gradual weakening of your bones until the pain hits. The reality is this: the older you get, the more prone you are to osteoporotic fractures. And if you're not paying attention, it could creep up on you without warning. So, when you hit 50, it's time to start thinking about your bones. In a strange way, aging itself is the perfect storm for osteoporosis. A storm that begins quietly but can result in serious damage if left unchecked. Picture this. A lot of people believe that osteoporosis only happens to the frail or elderly. But the truth is that you could have osteoporosis for years without even knowing it. How's that for a plot twist? A fascinating fact I came across. Studies show that by the age of 60, around 1 in 2 women and 1 in 5 men will suffer an osteoporotic fracture. This is due to the combination of age, lifestyle, and, unfortunately, genetics. But don't panic. There's plenty you can do to prevent this and protect yourself, even if you're on the later side of your prime years. So, what can you do to fight the inevitability of bone loss? Keep listening, and I'll walk you through the next key factor in increasing your risk of osteoporosis. Now, let's talk about the gender factor. It's one of those things we tend to overlook when thinking about osteoporosis. But it's absolutely crucial. Osteoporosis is much more common in women than men, and here's why. Hormones. For women, menopause is the game changer. When a woman's ovaries stop producing estrogen after menopause, she loses a major protective shield against bone loss. Estrogen plays a key role in regulating bone formation and resorption. So when the levels of estrogen drop, bone breakdown accelerates, and bone mass decreases rapidly. This is why women over 50 are at a much higher risk of developing osteoporosis than men. In fact, women are up to 4 times more likely to develop osteoporosis than men. And this risk grows exponentially after menopause. It's a sobering thought, isn't it? That one natural process, menopause, can set off a cascade of changes in the body that make you more prone to fractures and bone loss. It's not just about losing the ability to get pregnant, it's also about the impact on bone health. Estrogen is so vital to bone density that once it's gone, your bones are at the mercy of time. But that's not to say that men are completely immune to osteoporosis. As men age, testosterone levels drop too. And just like estrogen in women, testosterone helps maintain bone density. While men don't experience the sudden drop in hormones like women do, their decline in testosterone over time makes them susceptible to osteoporosis later in life. By the time a man reaches his 70s, his bone density could be significantly lower than it was in his younger years. Interestingly, when men do develop osteoporosis, it often goes undiagnosed for a longer period. Why? Because men's bones are naturally thicker and denser to begin with. It takes a more significant level of bone loss to cause noticeable symptoms in men. By the time they do experience fractures, the condition is often far more advanced. Here's a quirky fact for you. Did you know that men and women both lose around 1% of their bone mass per year after the age of 50? The difference, however, lies in how quickly this loss escalates post-menopause for women. That's why, when you look at the statistics, the risks for women are staggeringly higher. So, ladies, this is a reminder to take your bone health seriously before you hit menopause. And men, don't let the fact that it's not as common fool you. Osteoporosis is something you should keep on your radar too, especially if you're over 60. Moving on, let's talk about the role of family history and genetics. Now, you might think, well, I'm just living my life. What can my family history really have to do with my bones? But the truth is, your genes play a huge role in your overall bone health. Genetics, the blueprint of who you are, dictates how strong your bones are and how much bone density you start with. It's not just about the shape of your nose or the color of your eyes. It affects how your bones are structured and how your body maintains bone mass as you age. If your family has a history of osteoporosis, particularly among your parents or grandparents, your risk of developing it is significantly higher. You're literally more likely to inherit weaker bones. Think about this. Studies show that people with a parent who had a hip fracture, a common injury for those with osteoporosis, are at a 2 to 3 times greater risk of suffering from one themselves. It's like playing cards with a stacked deck. Your genetics determine the hand you're dealt. And if bone loss runs in your family, it's going to take a lot more effort to reverse the damage or avoid it altogether. But here's the kicker: you can't change your genes. So, it's essential to be proactive about protecting your bones, especially if osteoporosis runs in your family. For instance, even if your grandmother had brittle bones, and your mother had a hip fracture, you don't have to follow the same path. Genetics may load the dice, but lifestyle factors can change the outcome. Now, I know what you're thinking: I can't change my family history, so I'm doomed? Not at all. While you can't change your DNA, you can change your lifestyle and habits to fight back. Start by getting a bone density test earlier than recommended, especially if there's a strong history of osteoporosis in your family. Being aware gives you a fighting chance. You know what's surprising? The impact of genetics on bone health isn't just about having weak bones. It also affects how your body responds to things like diet and exercise. So even if you follow all the bone healthy advice, your results could vary depending on your genetic predisposition. One quirky fact that really stood out to me: African Americans tend to have denser bones and are generally less prone to osteoporosis than other populations. But that doesn't mean they're immune. Genetic factors influence everyone differently, but all of us must pay attention to our own risk factors. Starting with family history. So, it's not all bad news. Genetics gives you a head start, but it's your decisions and lifestyle that will make the most difference in your bone health. Now, let's explore how lifestyle choices can significantly influence your risk of developing osteoporosis. This is where you can really take charge of your bone health. It might surprise you to know that some of your everyday habits could be weakening your bones, and they are completely under your control. First, let's talk about diet. Calcium is the essential building block for healthy bones, and vitamin D is crucial for helping your body absorb that calcium. Without these two nutrients, your bones will become weak and fragile. So, when was the last time you made sure you were getting enough calcium and vitamin D? If you don't get enough from your diet, it's time to start adding supplements to the mix. The recommended daily intake of calcium for adults over 50 is about 1.200 milligrams. And for vitamin D, it's 800 to 1.000 IU. But it's not just about popping a pill. Calcium-rich foods like dairy, leafy greens, and fortified cereals should be your first line of defense. Vitamin D comes from the sun and can be found in fatty fish, egg yolks, and fortified foods. But here's something quirky that I learned. A lack of calcium won't just lead to brittle bones. It can also cause muscle cramps and numbness in your hands and feet. That's right, your bones and muscles are interconnected. So if you're feeling a bit off or getting frequent cramps, your body might be trying to tell you that you're missing some vital nutrients. Then there's exercise, which is absolutely critical. Weight-bearing exercises, such as walking, running, and resistance training, help build and maintain bone density. You don't need to be in a gym every day lifting heavy weights. Even something as simple as walking 30 minutes a day can make a huge difference. Exercise not only strengthens bones, but it also improves balance, which can reduce the risk of falls. And as we all know, falls are a huge danger for people with osteoporosis. According to some studies, people who engage in regular weight-bearing exercise have higher bone density and a lower fracture risk. Now, let's talk about smoking and alcohol. Two lifestyle habits that are absolute enemies of your bones. If you're a smoker, you're putting yourself at a higher risk of osteoporosis. Smoking decreases blood flow to your bones, which weakens them. Similarly, excessive alcohol consumption interferes with the balance of bone-building cells and bone-resorbing cells, making it easier for bone loss to occur. The key here is moderation, whether it's drinking alcohol or smoking. Even cutting back can reduce your risk of bone loss significantly. But it's not just about the things you shouldn't be doing. It's also about the things you should be doing. Consider incorporating more bone-friendly foods into your diet, like nuts, seeds, and fish rich in omega-3s. These can reduce inflammation and contribute to overall bone health. A fascinating piece of trivia that you might find surprising is that alcohol isn't just a concern for those with osteoporosis. Heavy drinkers are also more likely to suffer from vitamin D deficiency because alcohol can impair the liver's ability to convert vitamin D into its active form. So, it's a double whammy, weakening bones and decreasing vitamin D absorption. And finally, let's talk about sun exposure, or rather, the lack of it. We often hear that too much sun can be harmful. But did you know that lack of sunlight can affect your body's ability to produce vitamin D? So, if you're always inside, not getting enough sunlight, your bones could be at risk. A little sun exposure, 15 to 20 minutes a few times a week, can do wonders for your bone health. So, if you're not already paying attention to your diet, exercise, and other lifestyle factors, it's time to start. These habits are like the foundation of a house. They set the stage for everything else. And remember, osteoporosis doesn't happen overnight. It's a slow process that takes years. But the good news is, you can reverse the damage or at least stop it from progressing by making healthier choices. Now, let's dive into the role of chronic conditions and medications, two factors that often go unnoticed when considering the risk of osteoporosis. You might be thinking that osteoporosis only occurs in older adults with poor lifestyle choices. But the reality is more complex. The presence of underlying medical conditions or the long-term use of certain medications can accelerate bone loss and increase your risk of fractures. First, let's talk about chronic conditions. Conditions like rheumatoid arthritis, RA, and type 1 diabetes can significantly impact your bone health. RA, an autoimmune disease, involves inflammation in the joints, and chronic inflammation can lead to bone resorption, bone breakdown. Over time, the bones weaken, increasing the risk of osteoporosis and fractures. Interestingly, the medication used to treat RA, steroids, can also exacerbate bone loss. Corticosteroids, which are often prescribed to manage inflammation in conditions like RA, asthma, and autoimmune diseases, weaken bones by interfering with calcium absorption, reducing bone formation, and increasing the amount of bone resorption. Long-term use of steroids is a major risk factor for osteoporosis. It's quite a paradox. Medication meant to treat inflammation can worsen your bone health. Next up, type 1 diabetes. People with this condition often have low bone mineral density. High blood sugar levels in people with diabetes can lead to poor bone quality, which puts individuals at higher risk of fractures. Insulin resistance, which often accompanies type 2 diabetes, can also affect bone strength. This is an often overlooked aspect of diabetes care. So, if you're managing diabetes, whether type 1 or type 2, make sure to monitor your bone health regularly, especially if you're on medications that could interfere with your bones. Medications aren't just limited to steroids. Certain cancer treatments, such as chemotherapy and radiation, can lead to bone loss as well. Chemotherapy can reduce the production of estrogen in women, which, as we discussed earlier, is a critical hormone for maintaining bone density. Similarly, breast cancer and prostate cancer treatments can involve drugs that reduce estrogen or testosterone levels. And these hormonal changes are directly linked to bone loss. Tamoxifen, used in breast cancer treatment, and aromatase inhibitors both increase the risk of fractures in breast cancer survivors. And let's not forget that bone metastasis, when cancer spreads to the bones, can severely damage bone tissue, further increasing the risk of fractures. Thyroid disease is another medical condition that can affect your bone health. Hyperthyroidism, an overactive thyroid, increases the metabolism and can accelerate the breakdown of bones. If left untreated, hyperthyroidism can result in significant bone loss. Similarly, Hypothyroidism, underactive thyroid, may also contribute to weakened bones, although the link is less direct. Hyperparathyroidism, which involves excessive secretion of parathyroid hormone, can also lead to bone loss. This is because the excess parathyroid hormone increases calcium levels in the blood by pulling it from your bones. The one condition that stands out the most in connection with osteoporosis is celiac disease. This digestive disorder interferes with nutrient absorption, particularly calcium and vitamin D, both of which are essential for bone health. People with celiac disease are more prone to developing osteopenia, the precursor to osteoporosis, and osteoporosis. A gluten-free diet can help manage the disease. But individuals with celiac disease still need to be mindful of their bone health through diet, supplements, and regular bone density checks. So, when it comes to osteoporosis, it's important to consider your medical history. If you have any of these chronic conditions or are taking medications like steroids or chemotherapy, your bones may be at a higher risk. The good news is that by managing these conditions and adjusting your lifestyle accordingly, you can still keep your bones strong. It's just one more reason to stay on top of your health and be proactive in preventing osteoporosis. Let's now take a step back and look at the bigger picture. Osteoporosis isn't just about age, it's about genetics, lifestyle choices, underlying medical conditions, and even the medications you take. It's a combination of factors, each of which can be managed, reduced, or mitigated through healthy living and regular medical checkups. In conclusion, understanding the risk factors of osteoporosis is the first step toward prevention. While age, gender, and genetics certainly play major roles in the development of osteoporosis, the good news is that many risk factors are manageable. As we've discussed, lifestyle choices like diet, exercise, and avoiding smoking and excessive alcohol can dramatically reduce the risk of bone loss. You can improve your bone health by prioritizing calcium and vitamin D, staying physically active, and avoiding behaviors that harm your bones, such as smoking. On top of lifestyle changes, it's crucial to be aware of medical conditions and medications that may contribute to bone loss. If you have a family history of osteoporosis or any of the chronic conditions we've discussed, consider getting a bone density test at an earlier age. Early detection is key. Many people don't realize they have osteoporosis until they experience a fracture. But with proper monitoring and intervention, bone density loss can be slowed or even reversed. Regular checkups and a proactive approach to your bone health can make all the difference. Keep in mind that osteoporosis doesn't develop overnight, and its progression can often be slowed with the right treatment plan and lifestyle adjustments. So, whether it's adding more calcium-rich foods to your diet or taking up some weight-bearing exercise, every little change you make can help keep your bones stronger and more resilient in your later years. Remember, while the risk factors we've discussed are real, they're not inevitable. With the right knowledge, commitment, and lifestyle changes, you can significantly reduce your risk and live a long, healthy life with strong bones. To wrap up, take a moment to evaluate your own lifestyle and consider how the information in this video can help you make changes for the better. Don't wait until a fracture happens. Take action now to safeguard your bones and ensure you live your golden years in good health. Thank you for listening, and as always, if you found this video helpful, please remember to like and subscribe to my channel for more useful health tips and advice on osteoporosis prevention and overall wellness. Stay strong, stay healthy, and remember, it's never too late to start taking care of your bones.